Hey everyone, ready for a deep dive? We're tackling hip pain today, especially hip bursitis, that ache on the side of your hip. We're going to figure out what really helps with insights from physical therapist Dr. Dwayne Chioda. He's got a great YouTube video out on this. So, before we get into the exercises, imagine this. You're feeling this pain on the outside of your hip, and maybe it's tender, maybe a bit squishy.
And that's classic hip bursitis.
Right. But always get that checked out by your doctor for a proper diagnosis.
Oh, absolutely. Gotta be sure.
Okay, let's say you've seen the doc, you've got the official hip bursitis verdict. What's next?
Well, that's where Dr. Chioda comes in.
He walks us through 4 exercises that are supposed to help.
Yeah, and it's cool because these exercises, they're not just random. They actually target the root causes of hip bursitis, like tight hip flexors or weak glute muscles.
Okay, there's a method to the madness. I like
Okay.
it. First up is the dynamic hip flexor stretch.
This is a good one.
So Dr. Chioda describes starting in a half-kneeling position with the leg you want to stretch extended behind you. And here's where it gets interesting. He says it's super important to engage your glute, your butt cheek, on that back leg before you even start the stretch.
It's all about stability.
So why is that so important? I mean, we're stretching the front of the hip, right?
Right, so think of it this way. When you engage your glute, it helps to stabilize your pelvis and make sure that you're targeting the right muscles during the stretch. It's like setting a good foundation.
Got it. So it's all about precision.
Exactly.
Okay, so you're in that half-kneeling position, glute engaged. Then what?
Then you just slowly shift your weight forward until you feel the stretch in the front of your hip.
Hold L on.
Hold for a beat, then go back to the starting position, and you just keep repeating. And you don't want to force it.
Yeah.
Dr. Chioda really emphasizes gradual progression.
Which means?
Start with a comfortable range of motion. Maybe aim for 12 to 15 repetitions on each side. And then each time, you gradually increase that stretch a little bit more.
Got it. Slow and steady, especially with those hip flexors. What's next?
So we're going from stretching to something called tissue release, and we're going to use a tool for this one. A lacrosse ball or even a tennis ball.
Okay, how does that work?
You're basically using the ball to work on the tissues surrounding the bursa, that inflamed fluid sac that's causing the pain.
Oh, right. So is it like a massage?
Exactly. Think of it as giving your hip a little TLC, a little massage. You're using the ball to gently break up adhesions and reduce that inflammation around the bursa.
That makes a lot of sense. So where do we put the ball?
So first, you got to find the bursa, which is usually that tender, often kind of squishy spot on the side of your hip. And you're going to work around it, not directly on it.
Work around it, okay.
Yeah, Dr. Chioda describes it as a horseshoe pattern around that tender area.
So we're drawing an invisible horseshoe with the ball.
Exactly. And you want to work on each spot, the front, the side, and the back, for about 30 seconds to a minute, adjusting the pressure as you need.
How much pressure is too much?
That's where listening to your body is key. You always want to start with gentle pressure and then gradually increase it if you need to, but if you feel any short pain, you got to back off. It should be more of a hurts so good kind of feeling.
Hurts so good. I like that. All right, so we've done stretching, we've done tissue release. What's next? What else can we do?
Now we're moving into building strength, and this is where the modified side plank comes in.
Modified side plank. All right, how do we do that?
So you're basically lying on your side with your knees bent, hips stacked on top of each other.
Okay, I think I can picture that.
Now, brace your core, engage those glutes, remember those glutes, and then you're going to lift your body up, opening up your hips at the top.
So we're holding that open hip position. How long are we holding it?
You're going to hold that for 10 seconds, feeling those muscles work, and then you slowly lower back down. Dr. Chioda suggests doing 10 repetitions on each side.
10 seconds. It doesn't sound like much, but I bet you can feel those muscles working.
Right.
All right, ready for the 4th and final exercise? All right. This one's really interesting because it's all about how you transfer your weight when you're walking and standing, something we do every day without even thinking about it. He calls this the step exercise for weight shift, and you need a small step, like a stair, about 6 inches high. It's also a good idea to have a counter or a railing nearby for support, especially when you're starting out. So you stand on your affected leg, keep it straight, and then slowly lower your other foot down towards the ground, almost like you're reaching for something.
And as you're lowering down, you should feel the load in your lateral hip, and you might even feel it in your abs, too. That's a good sign that you're engaging those core muscles.
Oh, wow. It is all connected. Okay, so you feel that load in your hip, and then what?
From that lowered position, you slowly pull your hip up and hold it for a count of 2 before gently lowering back down.
And how many times do you do that?
Aim for 10 to 15 repetitions on each side.
It's one thing to hear these exercises described, but was there anything that stood out to you as really important in Dr. Kyoto's explanations? Anything that we should highlight?
It really struck me how much Dr. Kyoto emphasized that everybody's hip bursitis is different. Like, you really need personalized guidance. He even said people hit plateaus, which I thought was interesting.
It's like you hit a wall, right?
Yeah.
You're making progress, feeling good, and then suddenly you're stuck. So why does that happen with this?
Well, our bodies are really good at adapting. We do these exercises, things get better, but then, I don't know, our bodies kind of get used to it and plateau. Like, they need more of a challenge.
So it's not us doing anything wrong.
No, not necessarily. It's just our bodies doing their thing.
So how do you get past that? Do you just, like, do more reps?
That's where seeing a physical therapist comes in. They can look at how you're doing, what's working, what's not, and then change up the exercises. Maybe increase resistance, try a different angle, or even add new movements.
Oh, so it's like having a personal trainer for your hip.
Yeah, exactly. And Dr. Kyoto actually gave a great example. He had a patient who'd plateaued with that modified side plank. He had them put a resistance band just above their knees, and that was enough to challenge the hip abductors and get them past the plateau.
Wow, that's a small change, but a big difference. It's like that saying, what got you here won't get you there.
Yeah, exactly. Sometimes you got to switch things up to keep improving. And that's where that professional guidance is really helpful, I think. They can spot things we might not see ourselves.
It makes you realize how much goes into physical therapy. It's not just like do these exercises. They really understand how the body works.
Exactly. And it's not just about fixing the pain you have now. It's also about preventing future injuries and staying mobile as we age,
Yeah.
It's an investment.
Yeah, we often think about it for after an injury. But you're right, it's like going to the dentist for a checkup.
That's a great way to put it. Just like dental hygiene, if you incorporate these kinds of exercises regularly, it can make a huge difference for your hips.
I like that analogy. We brush our teeth, we eat healthy, and this is just part of taking care of our bodies.
Exactly. And the best part is that a lot of these exercises are things you can easily fit into your day.
Speaking of, is there anything else about these specific exercises that we should tell our listeners? Like anything Dr. Kyoto emphasized?
Yeah, let's talk about that dynamic hip flexor stretch again. It's easy to forget about engaging that glute on the back leg.
He really emphasized that, didn't he?
Yeah. And it's really important. It's almost like you're tricking your hip flexors into relaxing.
Oh, how so?
Well, think about it. They're often tight from sitting all day. So when you engage your glutes, it's like telling your hip flexors, it's cool, you can relax, and that gives you a deeper stretch.
It's like you're outsmarting your own body. I love it. And
Yeah.
it makes you realize that everything's connected.
It really is.
Okay, so that's the glute trick for the hip flexor stretch.
Sure.
Anything else about, how about the tissue release exercise? Anything we should emphasize there?
Oh, yeah, for sure. When you're doing that tissue release, remember how we said you work around the bursa?
Right.
He made a point of saying, don't press directly on it.
Oh, interesting.
Yeah, it's tempting to wanna really get in there, but it's better to work around it. He actually used a good analogy. He said it's like, imagine you have a mosquito bite. You don't want to scratch right on the bite, do you? You kind of want to itch around it.
That makes sense. It's about calming things down.
Exactly. And it speaks to that whole idea of moving mindfully, paying attention to your body.
Working with it, not against it.
Exactly.
I like it.
And that actually brings us back to something we talked about earlier about personalized guidance. These exercises are great, but everybody's different, right?
It's like trying to make everyone wear the same size jeans.
Exactly. So that's where a physical therapist can be so helpful. They can figure out what you need and create a plan just for you.
Like a personalized map for your body. So yeah, if anyone's listening and dealing with hip pain, don't wait. Go see a professional. It can make a huge difference. This has been so interesting. I never realized how much we rely on our hips until something goes wrong.
I know, right? But the good news is that we can do something about it. It's not just about fixing the pain. It's about, like we were saying, making these exercises part of our routine.
Yes. Preventative care for our hips.
Exactly.
I love it. Well, on that note, thanks to everyone for joining us for another deep dive. We'll be back next time with a brand new topic. Until then, take care of yourselves.